our center here at the Stan Cassidy Center is a very interdisciplinary group that over the past 10 years we've really grown our research capacity to have this core interdisciplinary team. So we have physiotherapists, occupational therapists, psychologists, rehabilitation physicians all working together very specifically around areas of improving mobility and improving function for people who live with disabilities. One very interesting project that we've been working on over the past couple of years is looking at using electrical stimulation techniques in a functional way. So you activate muscles that are paralyzed, and by activating them with this electrical current, you then, for instance, can make a hand open and close so that you can hold something, or you can activate muscles in a leg and perhaps pedal a bicycle. And we're looking to try and see if by doing these types of therapies, if we can actually improve a person's neurologic recovery, actually make a difference at the brain and spinal cord level that will impact on their long-term recovery. We're also looking at the various health impacts of doing electrical stimulation types of therapies. So looking at patients' spasticity or management of their tone, looking at their quality of life, and looking at their pain outcomes. It's always a challenge when you're working with people who have particular diseases that aren't very common, perhaps a little more rare, or not as affecting such a great number of the population. And that's the case for many of our patients. Individuals who've had spinal cord injury or who are impacted by diagnoses like multiple sclerosis or Lou Gehrig's disease. And so we really have to work hard to advocate for health dollars directed towards research towards these smaller groups of populations. And even though these patients represent a smaller, perhaps, percentage than what we might see in diabetes or heart disease, the implications of living with an impairing disease, how it impacts on your mobility, significantly impacts the cost to the system, the psycho-emotional and socioeconomic costs for an individual and their families, and that impact on the community. So even though sometimes when we talk about doing research in spinal cord patient, we say, well, you only have maybe 30 to 50 patients a year with a spinal cord injury. But the lifetime costs for a patient like that can approach the millions. And therefore, investing upfront healthcare dollars towards clinical health research for these populations gives us the potential to really make a significant long-term impact, not just for the patient, but for the community as a whole, and our overall healthcare and economic burdens.